assessment. What is the way we do the assessment techniques? We can do traction. We can use a slide. We can do that in a maximal loose packed position or in another position, for example loose packed. How do we build it up? If you want to provoke the capsule in the most intensive way, for example for an extension problem between radius and humerus, then I do not use a traction technique because that provokes all capsule parts. If I want to provoke one capsule part, the anterior one, I use a slide because a slide provokes one capsule part, so it's more intensive. Agree? We slide in the direct way, in the affected direction, which is a dorsal slide. If I apply a slide dorsally with the radius in relation to the humerus in a position that is almost end position, then the risk of provoking the anterior capsule is the biggest. So a hit for my positive test is the best possible in a loose packed position. What is loose packed position? Loose packed is a position away from the maximal loose pack, which is in the elbow joint 70 degrees of flexion, 70 degrees flexion, and from mid position a little bit supination. If I have an extension problem, my elbow, then the loose pack position is away from the maximal loose pack in the direction of the problem, till it's painful, and now a little bit back, pain gone again. Submaximally in the affected direction, so that the affected capsule is pre-stretched. Yeah, that's the loose pack position. So the most intensive technique in assessment to provoke a capsule part is to use a direct slide in the loose pack position. And the loose pack position depends on the patient's problem. If I have a patient with a flexion, combine a slide technique with an angulation, there is a risk of provocation ligaments, skin, muscles, tendons. So if you do a direct slide without angulation, the theoretical chance of provoking the affected capsule is the biggest. Only if I combine it with angulation, it's even more intensive for the affected capsule, with the risk that something else is provoked. That's the problem.
Yeah, because
Yeah?
contrast
Okay.
actually,
Yeah?
because in one way you're
Okay, I'll give you another reason for contrast. A slide technique in a loose pack without angulation is a non-physiological movement. It never happens. It's always a combination in nature, in human body. But it's damn difficult to do it correctly.
Okay.
How much angulation, how much slide, how is the balance between the two? So what we try to learn you first is slide without angulation, and then slide with little angulation. Not too much angulation, because then the skin, the tendons, the ligaments, muscles will be stretched more. And we don't want that if you want to provoke the capsule. Yeah? So at the end of this module, I hope you will be able to do a direct slide or an indirect slide. If you don't want to mobilize but work on pain relief, we go to the opposite direction, because stretch on the painful part provokes pain. It's turning on the hot tap, more open. Now you have to jump. Yeah? So what I want you to do at the end of this model is be able to do a slide, indirect or direct, depending on the goal, in combination with a little angulation in the direction of the problem if you want to mobilize, and away from the problem if you want to work on pain relief. Yeah? Okay. So, if you put in an order from less provocative to more provocative, the first technique is traction in maximal loose back position, traction in loose back position, direct slide in maximal loose back position, direct slide in loose back position. Most intensive